Hi, my name is Jacqueline Ramirez, and I will be presenting HPV, human papillomavirus. What is HPV? Human papillomavirus, also known as HPV, is a common group of 100 plus related viruses spread through an intimate skin-to-skin contact. One of the main ones would be skin warts. They are usually part of this where they spread on skin-to-skin contact or surfaces, which can appear on hands, feet, and other skin areas around the body. They are harmless, non-cancerous, and are usually just cosmetic. There's also genital HPV, which are caused by mucosal HPV, which is transmitted by intercourse. Higher risk varieties can result in cancer, while lower risk varieties produce genital warts that does often show no symptoms. The low and high risk to this would be at low risk, they would cause warts but do not cause cancer. Where in the high risk of it can lead to persistent infections, which may cause abnormal cell changes over time, which could lead to cancer. Which some of the associated cancers that are involved would be cervical, throat, anal, penile, and virginal and vulval. This can be spread by, again, skin-to-skin contact, most commonly spread through the sexual contact, again, the vaginal, anal, and or sexual course, can be spread with even when there is no symptoms or visible warts. This virus enters through tiny cuts or abrasions in the skin or mucous membranes. Non-genital HPV types can spread this also through shared surfaces, just like gym mats, locker rooms, direct contact, and even clothing. HPV does not require intercourse. Skin contact is adequate. The majority of HPV carries and aware that carry the viruses. Although they reduce the risk, condoms can completely prevent HPV. Persistently high risk can cause cancer-related cell alterations. The most common symptoms or signs is they really doesn't have any symptoms. When it's presented, it's commonly just skin warts, abnormal pap smear, changes in the throat. Most individuals don't know they have HPV, genitals, warts, or any types of HPV. That there are little growth formed in the anal or genital areas caused by this virus that is spread especially via sexual contact, where you can end up getting flat warts, common warts, genital warts, or plantar warts. Performance is typically not limited by HPV. Potential side effects: discomfort caused by plantar warts or skin, some worry or anxiety following the diagnosis. There's embarrassment or self-consciousness that many affect mental focus. Although the majority of HPV infections are benign or asymptomatic, the effects on mental health might impair focus and confidence. Plantar warts or hand warts may cause pain during jogging, gripping, or even weight bearing, which might limit training intensity or technique for the athlete. Sweating skin abrasions that facilitate HPV entry and shared facilities like locker rooms and showers put athletes at a greater risk of getting HPV. Most athletes can continue training without much disruption if they receive the right care treatment, covering less lesions and excellent cleanness. Most athletes don't really have a long-term effect. This is a there's rare consequences to it, which the main one would be getting like cancer, where the cervical cancer, throat cancer, anal cancer, and etc. Some symptoms that might lead to cancer, or that you might be showing you might get cancer with HPV, would be fatigue, pain, unintentional weight loss, time away from the sport to get treatment. Most HPV infections cure naturally, and sportsmen do not experience long-term difficulties. In a young, healthy, active adults, especially athletes, HPV-related malignancies are uncommon. The HPV vaccine protects against almost all HPV-related cancers. Mental health and stigma is one thing that is common when someone has HPV. Most people develop it at some point in their lives. Due to these misconceptions about cancer risk and transmissions, may athletes experience needless and anxiety or humiliation. Stigma frequently originates from a lack of information, not the virus itself. But the role of an athletic trainer could be to be supportive, calm, and not judgmental, maintaining strict confidentiality, giving correct information or necessary, refer patients to medical or mental health specialists. Reducing the stigma enables the athlete to stay confident and engage in sports in a safe manner. This can cause, again, anxiety, fear, fear of cancer, embarrassment, and misunderstanding of transmission. Where people can get support would be like education, counseling, or even just confidentiality for the athlete. An example that I would like to show would be a 19-year-old female soccer player. A 19-year-old female soccer player receives an unexpected pap smear result, and she later tested positive for HPV type 16. A normal and invasive follow-up procedure is dedicated for her to further access the cervical alterations. She can play soccer without any restrictions despite the diagnosis because HPV has no effect on athletic performance. Following her assessment, she starts the HPV vaccination series to guard against subsequent higher risk HPV strains. This case exhibits typical therapeutic steps, screening, follow-up testing, and vaccination, while stressing that athlete with HPV can safely continue being active with adequate medical advice. So she went to a routine pap smear, gained the abnormal results, getting positive for HPV, undergoes through a colposcopy, then gets cleared to continue playing sports, and she begins to have her HPV vaccination series, which helps her stay positive, as also going through this is not easy. And this is my presentation, and thank you so much for listening.